Hi, I'm Senator Ron Johnson from Wisconsin.
And I'm Senator Kelly Ayotte from New Hampshire.
Over the last few days, we've asked you to share some of your questions and concerns on Facebook and Twitter about the President's unconstitutional health care law. You had a lot to say, so we're here today to answer some of your questions and discuss some of our solutions to our country's health care needs.
Our first question comes from Dick Hinch from New Hampshire, who asked on Facebook, didn't President Obama promise that his new health care law would bring down the cost of health care? Didn't Nancy Pelosi and President Obama promise this would immediately create new jobs? Where are they? The president said we could keep our existing health plans under this new law. Is this the case? Well, Dick, I got to tell you, unfortunately, when the president ran, he promised us that he would reduce health care costs by $2,500 a family if we passed his law. But the opposite has happened. The Kaiser Foundation estimates that health care costs per family have gone up $2,200 per family. And I've heard it from New Hampshire businesses and heard it from New Hampshire constituents that health care costs are going up more and more since this bill has passed, and we can't afford it. I'm really concerned as well when you think about this promise that you could keep your existing plan, because we've already heard from employers that say they're going to have to drop coverage for their employees. And also look at the Secretary of Health and Human Services had granted over 1,700 waivers from this law for 4 million people. That tells you right there, when the law is actually implemented, people aren't going to be able to keep their existing plan. And so that was a promise that the president made that has not come true. In fact, it's been a broken promise.
Well, Kelly, Obamacare is a series of broken promises, and coming from the private sector, it doesn't surprise me at all why health care costs are rising. All the mandates. I mean, the fact that the way the president is going to pay for the health care law by increasing taxes on pharmaceutical companies and drug manufacturers and medical device manufacturers and insurance plans. You know, when you increase taxes and penalties on business, you're going to drive up the cost. I mean, that's just common sense. You know, the other thing I'm concerned about is somebody who purchased health care for 31 years is, you know, CBO estimated only 1 million people would lose their employer-sponsored care and get put in the exchanges. But, you know, the decision for a business person is pretty simple. According to CBO, in the year 2016, a family plan will cost $20,000. So is that business person going to try and comply with 15,000 pages of rules and regulations and pay $20,000, or are they going to pay a $2,000 penalty? And in doing that, they're not exposing their employees to financial risk. They're making them eligible for a $10,000 subsidy if they have household income of $64,000. So my concern is there will be far more than 1 million of the 154 million people that get their care through employer-sponsored plans will lose that coverage, get dumped in the exchanges. And then there's another broken promise, because President Obama said, if you like your health care plan, you'll be able to keep your health care plan, period. You know, another broken promise.
Well, absolutely, Ron. And if you think about it, you know, we've already seen that employers are going to have to make the economic decision to pay the fine instead of keeping the coverage for their employees. And if you think about it, to put all of those employees who want to keep their plan into this government-run health care, they're not going to get what the plan that they had before or the coverage that they had before. And it's unfortunate, because what's going to end up happening is a group of bureaucrats in Washington are going to decide what gets covered and who's going to get what type of health care. That is not what this country is about. And unfortunately, this bill is a one-size-fits-all from the government, and it's going to cause rationing, which is a deep concern to our country.
No, we're going to lose our freedoms, and it kind of almost leads into our second question that comes from John Drescher, who asked on Twitter, what happens to life-saving innovation in the world of Obamacare? And of course, this one really is close to my heart, because, you know, our first child, our daughter Carrie, was born with a very serious congenital heart defect, and she was saved. She's 28 years old now, by the way. Yeah. Her heart operates backwards because we were able to seek out the most advanced surgical treatment at the time to end up with such a wonderful result, because we had the freedom to do that, and because America, we create medical miracles here in this country. And that is what is at risk. I mean, I think this health care law is going to definitely lower the quality of care, result in rationing, limit innovation, and oh, by the way, it's going to bust our budget. It's going to further bankrupt this country. In any way you cut it, Obamacare is a disaster for this country.
I couldn't agree with you more, Ron. And what a compelling story about your daughter, Carrie, and how that motivated you to run for the U.S. Senate when you saw what the president was pushing through in the middle of the night with Nancy Pelosi and Harry Reid, this awful bill. And I'm so concerned about innovation as well. We talked about Obamacare is paid through from taxes on businesses. Well, one set of those businesses is medical device companies. And we have been on the cutting edge in this country when it comes to getting the very best medical devices. When I think about the type of technology and innovation it would have taken to save your daughter, and yet there's a 2.3% tax on revenue on medical device companies. And I can tell you just from having meeting with New Hampshire employers, there was a great company in Manchester I met with, Coreflex, that showed me they're a profitable medical device company. They showed me their balance sheet after these taxes go in place in January to fund this health care bill. They are going to lose money. And what's that going to cause? It's either going to cause them to reduce the size of their workforce or less innovation, less research and development for new medical devices that can save patients like your daughter. And this is just outrageous. This is the wrong direction for our country. We have always been the country that has been on the cutting edge of innovation and coming up with the best new ways to treat people. And this bill takes us in the opposite direction, where we have rationing and government bureaucrats deciding these issues.
It's going to kill innovation. It's going to reduce jobs in America. It's going to drive those things overseas. So I think we're in agreement, and we're certainly determined to make sure that this law doesn't have to be fully implemented before we understand and the American people understand what it's going to fully cost and what the full, consequences of this bill is going to be. So again, I guess we'd just like to thank all of you for taking time to submit your questions about this health care law and its impacts on you and your family. If you're interested in continuing this conversation, we'd love to hear from you. Join us online as we continue our efforts here in the United States Senate to repeal this unconstitutional law and replace it with a more common sense, patient-centered approach to health care. Thank you.
Thank you.